Hello, my name is Matthew Tortora, and I practice diagnostic pathology in northern New Jersey, serving Cooperman-Barnabas Medical Center and Clara Moss Medical Center. In this video, I present to you a small sample of a multi-part lecture series on the history of renal medicine, which I've given to the departments of pathology, medicine, and humanities at Cooperman-Barnabas Medical Center. This sample is part of a lecture entitled Sphygmographs, Lardaceous Livers and Dropsical Effusions, A Far and Bright Journey from Richard Bright to Theodore Farr. If you enjoy this presentation, want to see more of the lecture series, or have questions about the history of medicine or pathology, feel free to contact me. Let's get started. Although this lecture takes place in the 19th century, I begin with a quote from the early 20th century. It is not possible to diagnose accurately during life the anatomic changes that will be found in the kidney after death. It is my goal with this lecture series to show the viewer how this ideology, one that persisted for millennia, was eventually overturned. We see before us the Thames River in London, looking southward towards Southwark, as it would have appeared in the early 1820s. Before crossing the river, a young physician named Richard pauses for a moment to contrast the new London Bridge on the left to the ruins of the recently demolished Old London Bridge on the right, one that itself had persisted for over a millennium. He's on his way to begin working at Guy's Hospital, pictured here. His name is Bright, and he will be joined by two other physicians, Thomas Hodgkins and Thomas Addison, to form what would be known as the Three Great. They would go on to revolutionize our understanding of numerous medical conditions. But as this is a discussion about renal medicine, it will focus on Richard Bright. To give context to London in the 1820s, one might conjure up stately images of Queen Victoria, the revival Gothic spires of the Parliament building, the soaring Tower Bridge, or the works of Charles Dickens. But that would be incorrect. In the 1820s, the decidedly less stately King George IV was sovereign. The Parliament building wasn't built yet, its predecessor having only recently burned to the ground. And Charles Dickens was only a boy, while his father, an exceptionally poor role model, was no doubt inspiring his young son's future writings. Speaking of George IV, he plays into our story in a tangential way. You see, although he is portrayed like this, in reality, he looked like this. He rarely left his quarters being plagued by ill health, in particular something that was called dropsy. In this image, we see a poor soul afflicted by the dropsy, her swollen belly being drained of its fluid. So what was dropsy? Dropsy was massive edema. To give one glimpse into the still archaic state of medicine as it existed at the time, I will read this definition from the time. The dropsy is looked on as an unnatural tumor in which all the body, or some of its parts, is swelled to an immeasurable bulk. 'Tis observed that this swelling may be produced by three several sorts of matter, namely by phlegm, wind, and water. That which proceeds from phlegm is called anasarca or lensa phlegmatia, a piteous dropsy, that caused by wind, tympexictes, or a tympany, and that formed by water, ascites. So they knew that edema could be severe in some people. They knew that it occurred in conjunction with other conditions, such as high blood pressure and protein in the urine, but they didn't know what caused it. Rising out of this disorder was Richard Bright's landmark publication from Guy's Hospital in 1827, a paper of observations on the anatomic associations of dropsy and other diseases, entitled Reports of Medical Cases. The text of its preface heralds the arrival of what will be the greatest attempt to overturn the tenets of the opening quote of this lecture. Within passages of the introduction, it's worth stopping to appreciate the historical importance of Bright's assertions. The morbid appearances which present themselves on the examination of those who have died with dropsical effusion are exceedingly various, and it often becomes a matter of doubt how far these organic changes are to be regarded as originally causing or subsequently aiding the production of the effusion. In other words, edema is associated with many conditions, which was already known, but to Bright, it was not clear as to which ones caused it and which ones are caused by it. If it were possible to arrive at a perfect solution of these questions, we might hope to obtain the highest reward which can repay our labors, an increased knowledge of the nature of the disease, and improvement in the means of its treatment. In other words, if we could better understand the cause, we might find a treatment. This might sound intuitive to a layperson today, but it was quite revolutionary at the time. He further emphasizes the importance of connecting symptoms with morphologic changes. He makes connections between a physical change and a laboratory abnormality, protein in the urine. Again, these concepts seem rote to the modern audience, but again, they were revolutionary in 1827. Now, one thing that hasn't changed is that good writing sells much better when accompanied by good pictures. And a good illustrator could achieve stunning results. The drawings from this 19th century Atlas of Anatomy, for example, are works of art in and of themselves. As it would have been hard to find an artist specializing only in medical dissections in the 1820s, Bright collaborated with a portrait artist named Frederick Say. As you can see, his reputation clearly preceded him. Here is Say's portrait of Richard Bright, which still hangs in Guy's Hospital today. Say would put the same gorgeous craftsmanship into each and every drawing for Bright's reports of medical cases. And now for cases illustrative of some of the appearances observable on the examination of diseases terminating in dropsical effusion, and in Bright's preferred order, and first of the kidney. He presented 24 cases compiled over 12 years, including 16 full-color plates. Let's look at a few of those revolutionary observations. One can appreciate the cobbled outer surface of the granular kidney, the paleness of the non-vascular kidney, the small contracted kidney of long-standing kidney disease, the large white kidney of a patient with nephrotic syndrome, which includes edema and protein in the urine, and the large red kidney of so-called acute nephritis, that is, acute kidney disease. Bright's reports of medical cases showed us that edema and protein in the urine were related to renal disease by connecting them to depictable structural pathologic changes in the kidney. Bright's observations of the kidney would enter the historical vernacular as Bright's disease, a term broadly applied to acute and chronic kidney disease, usually in the setting of edema, protein in the urine, and later hypertension or high blood pressure. It's a term that would persist well into the 20th century. As for Bright, he became known as the father of nephrology and would witness the birth of clinical nephrology. Perhaps more extraordinary than Bright's work is what followed in its immediate wake, but that's a story for another time. Thank you so much for joining me. Once again, if I've piqued your interest in the history of medicine or in pathology, feel free to contact me or follow me on X at Renal Pathology.